Hello everyone, I am Dr. Farah Ingale, Senior Consultant Physician Diabetologist and Director, Fortis Hiranandani Hospital, Vashi, Navi Mumbai. So as we all know, 14th November is celebrated as the World Diabetes Day all over the world. Now World Diabetes Day is celebrated for a long time just to focus attention of public and patients suffering from diabetes so that they understand the disease better. Here we focus on issues which are of utmost importance for the diabetics, for the diabetic community to understand the disease and take care of themselves better. So every year there are different themes, and this year for the later part, that is from 2021 to 2023, in the later part, the theme is Education to Protect Tomorrow. We all know that diabetes is a huge endemic problem affecting people from all walks of life, all ages and different areas from across the world. And it is a progressive disease, and the numbers are just multiplying, because as of now we have about 530 million people who suffer from diabetes, and this number is expected to cross about 700 million by the year 2040. And actually 1 in 3 adults, especially from the low income and the middle income countries, do not have proper access to diabetic care, and they have uncontrolled diabetes, because of which they land up in various complications. If the sugars remains uncontrolled, you can get all sorts of complications, for diabetes is known to affect any system of your body right from head to toe. It can directly affect your eyes, causing sudden blindness, immature cataracts, glaucoma. It can cause strokes, that is paralysis, which is 5 times more common in diabetics than non-diabetics. It can cause various heart problems, sudden deaths because of myocardial infarction, or heart attacks can happen, and which is 2 times more common in diabetics than non-diabetics, and many a times without symptoms, which is called as silent infarct. It can affect your kidneys, that is diabetic kidney disease. Your kidneys can fail. You may land up with undergoing dialysis for life. Paralysis can make you bedridden, and even other systems of the body can get affected. You can get infections. Wounds can sometimes not heal and cause amputation of the limbs to happen because of uncontrolled diabetes and wounds not healing, and many other problems you can get because of diabetes. And in fact, the irony is, especially in the low income and the middle income countries, that 1 out of 2 persons do not even know that they suffer from diabetes, and that is why 50% of them in fact goes undiagnosed or undetected. And as we all know, there are advances being made. Newer good medicines have come and has become available for use for diabetic patients. Newer technologies have been developed which helps us to understand the problem better, which can help us to diagnose diabetes at an early stage and to monitor the control of diabetes proper. We celebrate this day to make people aware of what medicines would be good. With the help of education, we spread awareness of the problem on this day from landing up in various complications. It's very important because diabetes is a holistic approach has to be utilized for the management of diabetes. It starts with your lifestyle changes, proper diabetic diet, then exercise every day, at least half an hour of walk or some other equivalent activity, and then you can even go for yoga. You should go for meditation or some mental relaxation techniques you should follow, because most of the times we concentrate only on physical activities, leaving aside the mental frame of mind, because stress is very important, which should be looked into. Because if you're physically active and you're following all the norms, controlling your diet, doing exercise, but you are under stress, your sugars may not remain under control. And also sleep hygiene is important, eating on time, sleeping on time, exercising every day. All these have to be sustained activities. And then, of course, meeting or consulting your doctor from time to time, because every time you may not understand what symptoms, even you may not get the symptom, as I told you in the very beginning, that silent infarcts and all can happen without any symptoms and signs. So consult your doctor from time to time. So following all these proper procedures and regularly checking your sugars, and on the instruction of your doctor, if they advise you continuous glucose monitoring or checking for glycemic variability, you should do that. That will help you only to keep your sugars well under control, and it will help you in staying healthy. So please look into all these and keep yourself